Okay. Hello, students. My name is Katie Matusik, and today with me I have Ethan, Hassan, and Caitlin. And we are going to talk to you about STIs, hepatitis B, and HIV. Hepatitis B and HIV are both sexually transmitted infections as well. We are all third-year pharmacy students at the University of Toledo. We're excited to talk to you today. So after you are done listening to our presentation, we would hope that you are able to distinguish the differences between STIs and STDs, to be able to recall common STIs and their symptoms and some information about them, as well as being able to distinguish HIV myths from facts. So I would like you to take a minute to think and reflect. You might have already learned about STIs or STDs in school. So what do you already know about STIs? And then what types of stigma or prejudices come to mind when you think about STIs or STDs? Maybe you've heard about them through media or through your friends or through your family. So go ahead and take a second to think about that. You can pause if you would like to. But we are going to move on and just teach you a little bit about some common STIs. So STI stands for sexually transmitted infection. It is an infection that can be transmitted by contact with infected bodily fluids or skin-to-skin contact. So some STIs are chlamydia, gonorrhea, human immunodeficiency virus, also known as HIV, or human papillomavirus, also known as HPV, and herpes. So you may have heard about some of these before. And there's an old term that was used more often called STD, which stands for sexually transmitted disease. So we have kind of transitioned into using STI now more commonly. So an STI is an infection. Infections are caused by bacteria, viruses, or also sometimes parasites. And an example of that would be pubic lice. So our example we have on the slide here is that HPV infection is an STI, and it will typically go away on its own. So the difference between that and an STD would be a serious health problem that's caused by an untreated infection. So if you have an infection, you don't get it treated, and it progresses, it can harm you and harm your body. So an example of this would be that HPV that doesn't go away could cause genital warts or cervical cancer. So those would be considered STDs because it's a problem that has been caused by an STI that hasn't gone away. So I'm going to turn it over to Ethan.
Hi guys, I'm Ethan. I'm going to talk to you guys about some common STIs. First off is chlamydia, and often chlamydia does present differently between men and women. Women usually have like a abnormal vaginal discharge or burning when urinating. Men usually have a discharge, also burning when urinating, and sometimes testicular pain. This can be treated. If not treated, it can cause infertility, pregnancy issues. Next, we'll go to genital herpes. This is often presents similarly between men and women. Usually they get sores or blisters and they can break and it's pretty painful. This cannot be cured. The virus stays in the body. Next, we have gonorrhea. In women, there's abnormal vaginal discharge again, also maybe bleeding, burning when urinating. And then in men, there's discharge, burning when urinating, and sometimes testicular pain. This can be cured. If untreated, it can cause PID or pelvic inflammatory disease or fertility issues. Next, I'll go to HPV. This can cause genital warts and cervical cancer. This is extremely common among young people, but there is a vaccine to prevent this called Gardasil. Next, we'll go to syphilis. This includes single or multiple sores on the body, which are often painless. There's different stages for this. If untreated, it can be life-threatening, and this can be cured. And lastly, I have HIV, you're at higher risk if you already have another STD or STI. This can be treated, but there is no cure. Okay, now on ways to prevent STIs. First off, and the best way is abstinence. So not having sex at all is the best way to prevent STIs. Condom use and making sure you know how to use condoms correctly. And then vaccines, like I said before, HPV can be prevented by getting a vaccine. Also getting tested. Some STIs have no symptoms, so it's important to get tested to be safe. And lastly, limiting amount of sexual partners. By this, you're less likely to spread and get STIs.
Hi guys, my name's Caitlin, and I just wanted to talk to you a little bit about HIV. So HIV is a viral sexually transmitted infection, and it requires a blood test to know if a person is infected. So this virus is transmitted through our bodily fluids, more specifically our blood, semen, preseminal fluid, vaginal fluid, anal fluids, and breast milk. So common symptoms that infected individuals may have are fever and chills. They may have a rash and muscle aches, a sore throat, fatigue, or just like feeling tired all the time, and mouth ulcers, which are like canker sores. So like we discussed earlier, HIV has no cure, but it is treatable. So it's very important that people with HIV are treated with what we call antiretroviral therapy, because it helps keep the infection from getting any worse, because it'll limit the number of viruses in the person's blood. And this is important because as HIV infections get worse and the number of viruses in the blood increases, there is a higher chance of spreading the infection to other people, and it also causes the person to become even sicker with something that we call AIDS. So AIDS is acquired immunodeficiency syndrome, and it's caused by the HIV virus as it attacks a person's immune system. So the more viruses that are in a person's blood, the worse the infection is, the larger the HIV army is per se. And that means that the larger the HIV army is, the more catastrophic of an attack it has against a person's immune system. You know, think of your immune system as a little army as well. So when the attack becomes too catastrophic from the number of HIV viruses, we diagnose a patient with AIDS because their immune system has become too weak. When your immune system becomes too weak, your body is more susceptible to infections like pneumonia and tuberculosis that typically wouldn't be an issue for your body to fight off, but because the HIV army has attacked your immune system so badly, it becomes more dangerous and your body is unable to fight off these other infections. And that's when our HIV patients with AIDS become hospitalized, and unfortunately some of them pass away because their immune system can't fight off all these infections. So this is why it's important for HIV positive patients to be treated with the medications. And if you take a step further back, it's why that it's important to get routinely tested for HIV. So how can we prevent HIV? In addition to the things that Ethan talked to you guys about, like abstinence, routine testing, condoms, limiting your number of partners, HIV is transmitted by blood, so never sharing needles between people is very important because needles come in contact with blood. Additionally, in certain high-risk individuals, we can prescribe medications to prevent HIV infection. So people who are not currently infected with HIV but are considered at high risk for getting HIV, they can take what we call PrEP, or pre-exposure prophylaxis medications. And then if someone has a high suspicion that they've been exposed to HIV already and they want to try to prevent the infection from not being able to be fought off by their own body, they can take what we call PEP, or post-exposure prophylaxis. So these people take medication after they think they've been exposed to HIV or they know they've been exposed to HIV. Finally, HIV positive patients who are being properly treated on their ART therapy that helps to reduce the number of viruses in their blood. And when those number of viruses become undetectable to the way that we test for the number of viruses, that decreases the risk of them transmitting their infection to an uninfected person very significantly.
All right, guys. Hello, my name is Hassan. I'm going to be carrying this discussion into the facts and myths that you may have heard from other people. Like, so there's been like facts and myths that are true and not true, and today we want to talk about stuff that are actually true and stuff that are actually not true. So in terms of HIV, there is ways that you can actually transmit HIV to other people. So if you're a person that doesn't have HIV, there's ways that it can get transmitted to you. Basically, the ways that it can be transmitted is having sex without a condom, sharing needles, contaminated blood products, and from mom to baby, it can be transferred. Ways they cannot really be transmitted, so it's a myth. So kissing and saliva is not a way that you can transfer HIV. Hugging, sweating, toilet seats, it's also a myth. You cannot transmit it by these shared food or drinks. You cannot transfer it that way. Also, water and air as well. You can like the air, you can't get it from the air. Animals and insects, they do not transfer HIV to you. All right, so prevention. So if you do have HIV and you want to prevent it from spreading, the best way to prevent it is abstinence, which is basically not having sex at all. Condom use is also a really good method. Not sharing needles is also a really good way to prevent it. And as Caitlin spoke about before, it's the medications, which are the PrEP, the PEP, and the ART medications. Ways that you cannot prevent so basically HIV will be transmitted is washing after sex, having sex with a virgin, the pull-out method, so basically that's sex without a condom, other contraception methods, and herbal medicines. All right, so moving on to hepatitis B. This is another virus that is a really serious one. Hepatitis B is a series of liver disease that results from the infection with the hepatitis B virus. The infection can be spread from having sex with an infected person, injection drug use, outbreaks, and at birth. The only way to know for sure if you have hepatitis B is to get tested. Some ways that is possible to have hepatitis B, so some ways that can show up with you is that if you have a fever, if you feel tired, if you have an upset stomach, you are always throwing up, dark urine, gray colored stool, some joint pain, and yellow skin and eyes, otherwise known as jaundice. The best way to prevent hepatitis B is by getting vaccinated. There currently is a vaccine that really does help you prevent getting the hepatitis B. All right, so we did get together a quiz that would really be helpful to us. If you guys can fill it out, we would really appreciate it. And if you guys have any questions about it or anything in general, just don't hesitate to give us a call or send us an email. And that's all we have for you guys today. Hope everybody has a good day, and we shall talk to you later.